Hi, it's Dr. Erica. Thank you for joining me. Please like, share, and subscribe if you haven't already. My main channel, Erica Onigbola Farm D. I am your registered licensed pharmacist here on YouTube. Please, again, like, share, and subscribe. I'm going to talk about opioids or the pain medications that are usually prescribed for severe pain, moderate pain, acute pain after surgery, those medications that we take to enhance our euphoria and to just help us feel better overall when we're dealing with a surgery or a postpartum cesarean section or childbirthing medications we take for our arthritis, medications we take for our severe pain, the most severe pain that we can adjust to is what we're talking about. Those medications that also cause death. I want to talk about this particular class of medications because of the latest news that was broadcast nationally about the Real Housewives of Salt Lake City, Miss Mary. Her son, Robert Jr., was recently deleted out of our earth after an overdose of painkillers or anesthesia or analgesic medications. These analgesic medications are very serious and they can be detrimental or deadly. Now, there are some reversal emergency medications called Narcan that can be used in those situations, but they have to be used immediately. They have to be used in a time frame that allows the patient or the person who's in distress to be revived. If the patient or person has been without that Narcan for some time, then that usually is not going to do any justice at that point. So the Narcan is a very important medication to have in hand at home with a family member who can utilize that medication upon learning a person or patient has fallen asleep or become sleepy or drowsy upon taking an opioid. That is when Narcan is best. The opioid class of medication can be for, again, those disease states, usually after surgery or dealing with pain due to the bone, pain due to a acute issue. Those medications are usually going to be your oxycodone, your morphine, your fentanyl, all of those that we usually in the pharmacy keep under lock and key because of their psychological dependence and their uh, potential for abuse in the community. Those medications, again, are used for pain. However, they can be detoured when in the wrong hands or in the hands of a mental patient or someone who's cognitively depressed or someone who's thinking about taking their own life. In this particular case, it has been found out that this person, Mr. Robert Jr., the son of the Real Housewife of Salt Lake City, Miss Mary, has learned that her son has finally succeeded at his goal of ending his life. He previously talked with his mother about the number of oxycodone tablets that he previously took on a previous occasion to end his life. So she was very aware of the potential when he is alone or without family when he's in his mental suicidal thoughts. Now, these opioid medications should be, again, supervised or taken into consideration with other family members. And I suggest that they be kept under lock and key until needed. And they only be taken if needed. Some people take them around the clock on a schedule, and then some people are more aware and tend to deal with their pain in a different way so that they don't have to take the opioid around the clock because they don't want to be a dependent on this medication. I call it zombie patients. When patient constantly takes opioid medication without the implementation of non-pharmaceutical pain relief, then the patient becomes dependent, and that's what I call a zombie patient. The patient has the right to take their prescription medications, and they also have the obligation to be responsible when they're being prescribed these medications. They're responsible for being truth about their pain level, and they also need to take responsibility to know who their doctor really is who's prescribing these tablets. So I just want to reiterate to the public out there that pharmacists, we do work hard in retail, community pharmacists. I have been a pharmacist for 13 years. I'm Dr. Erica. I hope this information has been helpful to you. If you would like, share, and subscribe if you haven't already, and I hope to see you on future videos. Take care. Dr. Erica signing off. Bye bye.